care of your knee the way you take care of your heart. Because heart gives you life, but knee gives you quality of life. Welcome to another episode of Straight Talk with Dr. Knee, the one and only Dr. Azam Badar Khan. Assalamu alaikum, doctor.
Wa alaikum salam.
How are you, doctor? I'm good, thank you.
Good.
Doctor, very important topic basically. Especially a lot of people don't understand that how important knee is. As I mentioned earlier, it has a very deep connection with giving direct, I should say, resemblance to heart health and knee health. It's very, very important basically. Now,
that's the main thing. What I'm trying to connect, that the way, as you rightly said, take care of your knee, the way you take care of your heart. So I would like to explain that. See, we all are very, very sensitive about heart. When it comes to the heart, a simple gastritic pain or some pinch also, we get hyper about it. So the same way, I want to promote that you should also be concerned about your knee. So, that's where it goes.
That's right. And the sayings are really, really great, as you rightly said. Now, doctor, coming to, I want to go deep down in, talking about the knee specifically today. So I want to understand, doctor, first of all, a lot of people don't know what diet makes their knee healthy, right? We know exercise is one part, but if we talk about diet, how do you look into that? If you can just let us know.
Basically we are talking about knee health and anything which is causing inflammation in the body, which could lead to damaging of any of the joints. So when we are specifically talking about knee, so I would like that a diet should be something which is non-inflammatory. Inflammation means that it is causing redness and swelling inside the joint. So any diet which could be vegetable, fruits, or non-processed food, these are very important, which keeps your inflammation low and keeps your joint healthy. So the knee healthy. A weight has a very important role to play in that. If you can maintain your weight towards the lesser side, that definitely it has a lot of less stress on the knee.
A lot of people say that to keep your joints and muscles strong, you got to have a lot of protein. And when I say protein, what I understand as a common man is you need to have a lot of eggs, you need to have chicken, you need to have fish and all of that. Does that also makes a healthy knee?
Protein, for the joint, it is not that important.
Okay.
For the joint, when we talk about the joint, I would be very specific, which I have been telling earlier also, that vitamin D and calcium, they play a very important role.
Yeah.
And as the data goes, that more than 90% of the population across the globe now, we belong from the Asian continent, and where we are supposed to have a lot of sun. This part also we are supposed to have a lot of sun. But on the contrary, it's a very ironical thing that every person is having less vitamin D.
As I was going to go to that side only. Yeah, you're
yes. Right. And then what happens is, again, I think probably I'm repeating it again, that when your vitamin D is less, the calcium from the blood it needs vitamin D to go to the bones. So the bone is weak. And when the bone is weak, then it invariably affects your joint. And that's when the cartilage starts getting worn off.
That's right. Doctor, since I believe a lot of your patients are from South Asia, right? Yeah. And though the problem is definitely regarding to knee, it's around the world, but talking about specifically which we see here normally in this part of the world in UAE, बहुत बड़ा मसला है कि सूरज कहाँ से मिलेगा हमें? How are we going to get the sun directly?
The problem है, sun है, but यहाँ का जो lifestyle है, sun आप नहीं exposure नहीं ले सकते.
So do you really think that somebody should go out in the beach every week?
नहीं possible है ना.
Yeah.
That's what I'm trying to say. इसलिए I have a set of medicines, rather I should say supplement, which includes vitamin D, vitamin B, magnesium, which takes care of your external health. Because मुझे पता है कि मैं कितना भी बोलूँगा, आप let's say a lot of people come, no, I don't want to take pills. They कुछ भी आप vitamin या supplement लिखते हो, they think that it is a medicine. Yeah. So first of all, I try to tell them that don't think that they are chemical medicine. It is not a painkiller, not a muscle relaxant. So just take out of your mind that you're taking a medicine. उनको लगता है कि इतना already by that age, like 40, 45 की जब हम बात कर रहे होते हैं, lot of people are already suffering from diabetes and hypertension, so they are taking those medicines as well.
That's correct.
So when you add these things, they think that it is a bunch of medicine and 10, 15. So I try to tell them that usko you take it as your diet. It is a part of your diet.
Yeah.
It's a supplement which is lacking in your body and it is causing harm to you.
Absolutely.
So that is why it becomes very important that you should be taking that.
That's right. एक क्वेश्चन आया मेरे माइंड में, बड़ा इंपॉर्टेंट है. एज यू राइटली सेड, आपने बोला कि आई गिव अ सेट ऑफ मेडिसिन्स व्हिच आर एक्चुअली नॉट मेडिसिन्स, दीज आर विटामिन्स मोर और लेस, राइट? तो कैन वी से दैट आई एम प्रिस्क्राइबिंग यू मल्टीविटामिन रादर देन ओनली विटामिन डी, एंड उसमें मल्टीविटामिन में भी कवर हो जाता है विटामिन डी, और वी शुड रियली टेक अनदर पोर्शन ऑफ
There is another twist. See, when we talk about, again, this question is also very much, I have to face this. They will say that I'm already taking multivitamin.
Yeah.
And it is a trend, I would say, that a lot of people...
Everybody's taking it.
Yeah, a lot of people, they think that to keep ourselves healthy, we should take a multivitamin. So it's a mix of everything, and so all the vitamins and minerals. But I'm very particularly saying those are for maintaining your health.
Okay.
When you're lacking already in a lot of those things, first you have to come to that level. Then only you can think about कि हम multivitamin ले रहे हैं, तो I don't need any extra.
That's a very logical answer, I believe. Yeah.
So for example, in a multivitamin tablet, there is only 400 IU of vitamin D.
Yeah.
When you are deficient, your requirement goes to 10,000 a day. So 400 and 10,000, there is a lot of difference. And as I said, 90% of the people are suffering. So usko pehle we have to bring it to the normal level, then only we can think about taking the maintaining dose.
इसी को लेके एक और क्वेश्चन है. Two options we have. You take a medicine or you get an injection. What do you suggest? And where is the injection important or the medicine?
No, I would say I would not like to demarcate it like that. Both has its own importance. But situation depends.
Yeah.
Situation in the sense, I'm not from the health point of view. I'm trying to tell from the financial point of view, the insurance point of view.
Yeah.
Most of the insurance is not covering your vitamin D test.
Okay. Okay.
So then in that case, that's what I think that's my way of handling things. We all know that injection has effect immediately, and tablets will take longer time to get the same effect.
That's correct.
So let me put it like this, that if you take a one shot of vitamin D injection, which is 3 lakh units, 300,000 unit, to my experience, practical experience, within 3 days, a person would say that I have, something is changed, my pains and aches have gone.
That's great.
So what I say that if, and the same thing if you take in tablets, it will take a month to get the same effect. So what I'm trying to say is where you are not able to do the blood test due to insurance issue or financial issue because it's expensive, the test is expensive. So I tell them, rather than spending on knowing what is your vitamin D level, take a shot of vitamin D, come back to me within three days to 1 week, and if you feel that more than 50% you're feeling better, that means your main issue is vitamin D.
But doctor, the thing is, in case if somebody is not doing a vitamin D test before, how would a doctor, understand that the vitamin D is low and injection is required or not?
That's a very, very good question.
Because just to add on to this question, I believe insurance is definitely an important part. But now there are so many ways, specifically when you're living in UAE, a lot of medical centers, a lot of even pharmaceutical companies, they're offering a package which is comparatively very low, and I believe everybody can definitely afford that once in 3 months or 6 months, I should say. तो उसको लेके तो I believe सबके लिए आसान होना चाहिए.
Yeah, as you rightly said, how do we know? When a person says that he gets up in the morning and when he's still in the bed, he feels that his joints are aching.
Yeah. Okay. That's very important. Yeah.
So there is two things to catch in that. And the second point is, if he says during winter, I have these kind of complaints.
Yeah,
more.
I was going to say that AC has a lot to play in that.
So which is more than the normal. In AC, normally we are cozy, we are little, but if he says no, I feel stiff, my body.
Yeah.
When I talk about stiff, then we also have to consider rheumatoid arthritis.
Okay.
But then that's a different category, so I will not go. For a normal person, if he says, so one is that. Second is that he is a young, middle-aged person, and he says that I climbing the stairs or doing anything, lifting anything, or some random thing, I get aches. That is also there. That also gives a signal. So what I'm trying to say is that in my practice as an orthopedic surgeon, I'm talking about external health, musculoskeletal system. It's totally different from internal health.
Okay.
For a layman person to understand, we are so much obsessed or focused or viral about internal health, diabetes, hypertension, cancer. अंदर की सारी problems पे उसी पे focus है. Everybody knows that I'm trying to run this global movement for knee health awareness. This comes from there also. I'm really sensitive about that. How can I get this musculoskeletal, all the external health for a layman to understand, into the picture of holistic, preventive health, because preventive health is only means 10,000 step. This diet, that diet, all these things are having a lot of all effect on your internal health.
Yeah.
External health needs it's more of a mechanical issue.
Yeah.
So it needs a mechanical way of handling and getting it.
Absolutely.
You're getting my point?
Yeah.
So that is what, again, for people to understand, mechanical, I mean to say muscle bones are more of a mechanics, like your joints is moving.
Movement all
like
the time, right?
Like a machine, it's moving. So there are certain things supporting it. It's not your sugar or
that's right.
Diets and all that is. So more or less it is the external health, which, so for that it is the external, which is stretching, strengthening, postures. Good posture can have a good effect on your joint.
Absolutely.
A bad posture for a long period of time. See, again, the thing is, when we talk about posture doesn't mean that हम 5 मिनट के लिए 10 मिनट के लिए बैठ गए तो कैसे खराब हो जाएगा. Let's say for namaz or for puja or for anything, if you're bending your knees and sitting for long hours, it is not that one time or 5 times in a day. It is over the period of 5 years that gradually that negative effects keep on happening, and then it ultimately gets into wear and tear. You're getting my point.
100%.
So that is what I'm trying to spread the message that why knee health is becoming so important.
Absolutely right. Talking of arthritis, before that, doctor, a person like me, सुबह उठता है और knee में दर्द हो रही है. Now, how would I, before going to the doctor, differentiate? Yeah, it's a normal one. It's fine. It's okay. It's going to be okay. Or I should literally think this is something really serious, or it may convert into some really serious arthritis or something else. How would I differentiate between a normal knee pain and an arthritis?
Normal knee pain, any kind of a normal thing should with the rest, it should subside.
Yeah,
it should finish
absolutely.
off. If it doesn't, that means there is something wrong. Or if it persists for a longer period of time. So having said that, if there is a swelling in your joint, if there is a movement problem, if there is a locking in your joint, or a pain which does not subside with rest, I think that's when you should, alarm bell it's a red flag that you should consult a doctor and get it checked.
I believe you've answered my second question, which I was about to ask you in regards to specific warnings, which needs to be taken care of. It needs a quick attention, actually. And that's absolutely right. That, of course, why would a person will have a problem in case if the knee is in the rest position, right?
you should if these things are happening and not subsiding, and that's when you should go to a doctor to get it evaluated. And there are different ways. A doctor would clinically check it. If required, he will do a investigation, which is MRI or X-ray, starting with the X-ray, and that would let us know whether that issue is something to be catered to.
A very important question, which I believe a lot of people have, not only in this part of the world, but har jagah pe. I think obesity has a lot to play in the knee problem, right? Doctor? Right? So I would really want you to put some light on that, how much important it is to maintain your weight, because overweight will definitely, not with multiple problems, but also, as you said, mechanical issues will come in. Absolutely,
exactly.
right?
I was about to repeat that word which I've already used. It's a mechanical problem.
I really want you to influence people about it. कि भाई ये बहुत important है, you need to maintain the weight, and that goes to me also, by the way.
Again, mechanical, as rightly said, I've already said कि mechanical, that has to be, any layman or any person, even a child, can understand that if you're obese means extra weight on your body, knee being the main joint of the body, which bears the whole weight of your body on a normal process, and any activity in 24/7 the whole day, the knee is getting the whole stress of your body. So any extra weight on your body is going to be having more negative effect on your knee, which will lead to more wear and tear and stress inside the knee, and into a wear and tear, which we call arthritis.
Absolutely.
Well, again, having said about obesity, there's a lot been spoken about now in a medical field. Obesity, I think, captures more than 30 to 50% of the whole into the, which is good in a way. It's good in a way, and there are a lot of things that been. I won't mind saying that. Saying is very easy, that you should reduce your weight, take care of your diet, but it is the rigid fat is not easy to get rid of.
That's right.
And when you're young, or when you're active in your life, that is a time when, if you say that you take care of, do exercise, take care of your diet, when you don't have any other worries in your life, you are only. Once you have a family, once you are career oriented, once you are focusing into your bread and butter and vision or mission, you need, if you want to take care of your weight, you need extra effort. So are you going to put your extra effort in your career and in your future, or losing your weight?
That's right.
So I'm just trying to say that there are a lot of things which are happening today. I don't know, should I say or not, but apart from diet and doing your exercise, there are few things which are available, medicines which are available, which are I would not say injections are available, surgeries are available to take care of that. Aesthetically. And I would not shy away from saying that, if required, through the guidance of a endocrinologist or a proper doctor, you should think of that and opt for that if required.
Yeah, that's right. Absolutely. Yeah. Doctor, just a question in my mind. You just mentioned that while doing puja or doing 5-time prayers, your knee does that movement all the time, and the passage of time, over a period of maybe 2, 3, 4, 5 years, you get into that. What about the athletes and sportsmen? And they are always doing these exercises and going to the gym. I'm also going, by the way. So all of these, I want to understand, will they not have any problem with the knee? Because they are also doing that same thing again and again, right? With the knee or leg workouts and all.
Yes, that's a very, very good question.
Should that create a problem, or should that make it healthy?
There is a very subtle line, very borderline, where you are either this side or that side. You will see most of the sports person during their active life of sports. Quite a lot of them, they leave the sports or they become lifestyle as That is when they go to the other side of the line, where all what they have done, they haven't maintained it. What they have done during their active life. Okay, let's say again, I'm coming back to the mechanical thing. When you're doing active thing, they're also doing stretching and strengthening.
Yeah.
So for me to say that no, it has a positive effect only and have a negative effect only is not correct.
Yeah,
it has both. So that's why any sports person gets an injury. Why they should not be getting injury if they are so active and actively playing their sports. When they get injured, they are redundant or till the time they recover 3 months,
Absolutely.
6 months, which no sports person wants to. So the point what I'm trying to say is that even in spite of in their active life, when they're active, then also they get injured. Recently in World Tennis League, when this question was asked to me that what is your recommendation for these kind of professional sports person, I have gone ahead and said that they should consider taking biologics, means the thing when they're doing actively, the supplements, the joint, knee joint has the fluid inside. When you're doing active, it is producing it, but at the same time, it is having a negative effect also. So negate that negative effect. There is no harm in taking the gel, the oil which is there, supplementing it with that, or even that PRP or a stem cell kind of a thing. I know for a fact there are a few countries in Europe, like Serbia. I was there in Serbia, and there the government is encouraging the sports person to take this so that it keeps it healthy. So the chances of having an injury is lessened by taking cautious
extra measures. Exactly.
So there's something again I would want a lot of people. See, the problem what happens is osteoarthritis patient comes. It's a very tricky thing. Why I'm talking about knee health and trying to raise this awareness is that people, when they come in the early stage of arthritis, early signs, we can see that there is an early signs of arthritis. When at that point of time, let's say you and me, well, I'm 50 plus, but for you who's 40 plus, is you see in the X-ray that there is early signs of arthritis. As a doctor, we can make it out. But for a person, as you just now said that you go to the gym also, if I tell you that you started having early signs of arthritis, you may have come to me for a knee pain while climbing a stairs or something. But at that point of time, if I tell you that you are having early signs of osteoarthritis, the name of arthritis itself will give you a jolt.
Exactly.
And you will be not receptive to it. Rather, you may not say anything on my face, but the moment you go out of the room, then you will say that, is this guy
something really
crazy or what? So we have to be very alert what I'm talking to the person. So what I'm trying to say is that is a time. So if knee health awareness or World Knee Day, Health Day, what I'm trying to pitch in for, the way we have World Diabetes Day, World Hypertension Day, these things, then people will be aware that knee issue is a surviving or life thing in the society.
Absolutely.
Then when we say this, that you are having early signs of arthritis to a 35 or 40 years old person, he'll be receptive to it.
Exactly.
Now the problem is there is nothing talk about prevention. It is only talk about treatment. So if I say something, then I'll be killed.
Yeah.
That's how we can put. So I have to be very alert. I try to say, do this exercise, that exercise, try to take supplements. But they will do the physiotherapy, they will take the medicine. Since it is early arthritis, his pain will go away in a week's time or 10 days. And it will not come back for a 6 month or 1 year. Because it is early arthritis.
And then it gets worse.
You have subsided
and then it comes
the
back.
whole thing. So that's a cycle, vicious cycle. Then after 1 or 2 years, again he will come, which will be already reaching the moderate stage.
Yeah, that's right.
And unfortunately, we doctors are also not focused on that. I'm saying, physiotherapy, go and do physiotherapy, take medicine. Who's going to spend so much of mind telling and doing? Because when both the things are there, who's going to spend so much of time explaining it? And also knowing that the other person is not going to take it positively, he will rather take it in a negative way.
Yeah.
So why do I spoil my reputation?
Doctor, by the way, just to you mentioned in your answer, I want to mention it to the audience. I'm not 40 plus.
Where are you right now? Sorry. No, okay. No, we shouldn't be. You must be near to 40.
Yeah, absolutely.
Okay.
एक पेशेंट आता है डॉक्टर के कमरे में और पेशेंट आके बोलता है डॉक्टर को, डॉक्टर ये प्रॉब्लम है, एंड फाइनली डॉक्टर डायग्नोसिस एंड अल्टीमेटली डॉक्टर सेज आपको ना नी रिप्लेसमेंट की ज़रूरत है. Now, as you rightly mentioned about arthritis, the knee replacement ka word itself will give a jolt to the person, right? Before answering or moving forward, I really want you to answer what is partial knee replacement and what is total knee replacement, so people would know that what is it. Then we can talk about it further.
I'll straight away tell as you are asking that when a partial knee replacement is done and a total knee replacement is done. Partial will be done. Knee has 3 different compartments.
Mm-hmm.
So if one compartment is affected, let's say the inner side, then that is the time when we say that it should be partially replaced. Because partially replaced means that and when it is the whole joint is involved in arthritis, then it is total knee replacement.
Okay. So we've got a very clear information on that part. Now, actually, when a person needs a total knee, TKR, we say total knee replacement, and what problems or issues can lead to a total knee replacement. I would also want to add on to this question that what is the age that comes to you कि अब ज़रूरत है, अब करनी पड़ेगा, अब जंग लग गया इसको?
I think you're asking me two questions.
Absolutely.
That, right? What is the age? First is that there is no age.
Oh, really?
There is no specific as such. There is no specific age when knee replacement should be thought about or should be considered.
So do we have cases where a young person has also gone for a knee replacement?
Yes.
Okay.
Why not? I'm saying young means even, it'll be taken wrongly if I say that even a teenager, if required, if the joint has been destroyed and he has to have a quality of life, then we do it.
But that could be more of an accident, right,
yes,
doctor?
Accident.
We're talking about because of some specific disease.
For a normal person, as we all know, that any kind of disease which used to be at age of 60, just minus it 20 years, and those things are starting at the age of 40.
Okay.
For that matter, diabetes, hypertension.
Yeah, that's right.
Let's say 25 years before, who would say that a person at age of 40 would have diabetes or hypertension? It was generally conceptualized that at the age of 55, 60, 65, people will start having these disease. But everything has come. So the answer to that is that there is no fixed age. If a person is having, especially when we are talking about rheumatoid arthritis, which starts at the early stage, it damages your joint. That is when most of the people at the age of between 40 to 50 are the rheumatoid arthritis patients who needs knee replacement to have a quality of life. What was your second?
Which disease lead to?
The rheumatoid, as I said, that in the early stages, rheumatoid arthritis is something which really damages your joint and need a knee replacement. But wear and tear, which we call a degenerative issue, which is basically osteoarthritis of the knee, that is usually more than 50 plus.
Doctor, I'm going to count on my fingers. I would request you to give me at least 3 or 5 points, main points, which will lead to a healthy knee until the age of, like, let's say 70, 80, where people would... I've seen my close relatives, jo 70 plus the, and doctor used to tell him that, mashallah, your knee is like 40 years of age. You don't need a knee replacement. You can let us know what will prevent us going towards this situation, if you can give me pointers, like, let's say exercise. 3 points. Okay.
Take care of your vitamin D.
All right.
Second, take care of your Be active.
Be active. Okay.
Active, again, I would like to say, active doesn't mean doing 10,000 steps.
Yeah.
With 10,000 steps, do your stretching and strengthening of the muscle.
Perfect.
When you do 10,000 steps, you are only taking care of your internal health. To keep your knee healthy, you need to do stretching and strengthening.
All right.
Give 5 minutes to that.
That's right.
Okay? Because most of the people, they don't do it. And the third is supplements. Apart from vitamin D, consider collagen, which is a very common thing now, which will keep your cartilage healthy.
Perfect. So we've got vitamin D, being active, and of course taking supplements. That's very important.
And I would also like to add, since we started with talking about the diet, take care of your diet also.
You don't have to be
less
obese.
Sugar, less processed food, and
directly
that
or
is
indirectly it has. Indirectly it has effects.
Some element of that has a negative effect.
Doctor, you've been doing knee replacements for more than a decade, I believe, right? And you've also done knee replacement through robotic surgery, right? Robotics. What do you see?
And also through personalized, customized knee.
Personalized, customized knee. Absolutely right. So how do you see? What do you prefer? I should say, एक हाथ से करना knee replacement, and then there is a robotic assisted knee replacement, which is more of an AI assisted, basically. Is it an advancement of what you do, or what do you suggest?
Yeah, that's a very good question, because I face this every time I get a patient who is coming for a knee replacement. People do relate with robotics, and robotic as such, the word gives you in your mind some positivity.
Yeah. What about I was going the other way. Trust issues नहीं आते लोगों को. Robot से कर रहे हैं, मुझे doctor चाहिए. The doctor is doing at the back end actually.
Today is the world of technology.
Yeah.
People are trusting more on the technology than the human being.
Okay, so please
that
elaborate.
is why, definitely, robot gives a more precision.
Okay.
So therefore, when it gives more precision, then it gives the outcome is better. The recovery and rehab is shorter and faster.
Okay.
But there are two important factors to that. Not for every case is required. From my personal thing, I would say that when it is a complex knee, a complex deformity is there, due to your previous injury or previous deformity or previous issues, there is where we really need a robotic. If we have that facility, we should not think about doing it on a conventional way. And overall, whether a robot or not, actually in knee replacement, it is robotic assisted knee replacement. Okay, so it is not totally the robot which is doing everything. But now the technology in knee replacement is also improved, where the robot is also doing the cuts when we are doing it. But overall, it is the doctor who has to feed all the information there.
That's correct.
So there where the importance comes, it's not that, go robo and do everything. And he does all the calculation and does it. Calculation is done by us.
So you feed it
there. So ultimately, it is our wisdom which is very instrumental.
Absolutely.
In that.
That's very important.
So that's how I will like to put it. It's a very important question. With the robot age, I'm saying with the robot becoming viral or across in our everything, people, even a layman also, uneducated person also understands what is a robot. So then it becomes very important for me to tell that robot knee replacement should be considered when it is a complex knee arthritis. For a normal one, trust on the doctor, because we ultimately is the one who is giving the feed there.
That's right. 2 questions I want you to answer together. How much time it takes for a person to recover, start moving after the surgery? I know it. I've seen it. But I really want you to tell the people, because there's going to be a broader audience.
I would love to
that. Exactly.
Say that, because there is a lot of myth or a lot of misinformation about, or not information about.
That's right. Yeah. Adding to this, a person whose knee is replaced, can do the same impact in his or her life, or I should say regular activities, or better than that, or he or she has to be careful. Let's say if we talk about heart, when you do a bypass or when you put up a stunt, you have to be very careful about the exercise, about a lot of other things. But I believe, I'm not exactly sure, you're the right person to tell whether it is opposite to that, कि आप ज़्यादा अच्छा impact create कर सकते हैं, आप तेज़ भाग सकते हैं, या you'll walk long, or how does that work? दोनों का अगर आप जवाब दे दें.
Can I, two questions you asked. Okay. Yeah. I'll try to answer the second one first, and then I'll go to the first one, because first one is very straightforward answer.
Okay.
The second one is not a very straight. I need to explain it to this thing. When leaving aside a knee replacement which is done for a middle-aged person, majority of them are done after the age of 55, 60, right? Okay, because it's an old age.
Yeah.
Arthritis may start from the age of 40, 45, but by the time it is bad where we go for a knee replacement, it is another 10, 15 years down the line, depends upon how you have taken care of it. Your question is, what are the activities we can do? We are talking about the second one, right? At the age of 60, how many people around you are playing sports?
Hardly any.
Yeah. So then why are we getting this question that what are the activities that you can do?
Okay.
So
got it.
So then I'm trying to say there is a low impact and a high impact.
Okay.
Low impact is a normal swimming activity, cycling, or these kind of things, which is acceptable after a knee replacement. Any person can do it. When we talk about high impact, is where there should not be a bump on the joint, which is running, or contact sports, which is football. So how many people play sports, football or tennis or these kind of things after the age of, though we talk a lot about being active and be sporty and all that, but again, there are 10-15% of the people at the age of 60 also doing all these activities, but most of them are not. So low impact is something which we can do after the knee replacement. Should I answer the first question also?
Yeah, please.
This is a very, very important thing which I want to tell all the people who are suffering from osteoarthritis, advanced osteoarthritis of the knee, and where you have been told that your permanent treatment is knee replacement. Because when we talk about permanent treatment, even if, I'll stress on that, even if you don't do a knee replacement, you're not going to die. Knee replacement is a quality of life surgery. It is up to you. It is not the doctor who will decide that you have to do the surgery at this time. We can only advise you that yes, your knee, depending upon your own condition, the quality of life which you are expecting and it is not happening, 3-4 points are there. And so it is you who have to decide that when you want to go ahead with the knee replacement. X-ray wise, we can all say that yes, this X-ray is bad enough, advanced is showing advanced osteoarthritis, so go ahead and do the surgery. So that is a very important point. The second important point is there is no bed rest after knee replacement.
Okay, now this is very important.
Very important. Why? Because any orthopedic problem, people think that's a concept, because when we talk about orthopedic surgeries, 90% of the time, these joint replacement and all are something in the last century or 2 centuries. But before it was only fractures. When we do a surgery for a fracture, we align it, fix it with a screw and plate, let the healing go on its normal process, which takes a month and a half. So that period of time, the screws and plate or the rod what we have put, we have aligned it. We haven't brought new bones into that. So it takes time. So that is why the stress on that part should not be there. And therefore, you had to be on bed rest.
That's right.
Bed rest. But when we talk about knee replacement, it is a replacement that we are doing. We are not fixing anything there. It is something like a wall. The 2 bricks are there, we are putting a cement there and it gets stuck, stick to each other within 5-10 minutes and the whole game is over.
Yeah.
So once we have fixed it, so then there is no point of rest. On the contrary, the more you walk, the more you do your muscle activity, the faster you heal.
Okay.
So therefore, what I'm trying to say that after the knee replacement, it has become a norm now that within 24 hours, you should make the patient stand, walk, do everything. I would like to share that I have also made patients after the surgery on the operation table to walk him to go to the recovery room.
Are you serious?
Within an hour's time also, patients have walked. And it has been there. It was covered by the Khalij Times also. That
wow, wonderful. So that is very, very opposite to some other surgeries, right? A lot opposite. Because again, the thing comes कि it's because mechanical part hai, so it keeps on moving. It needs to be moving, right?
Moving, yeah.
Yeah.
It heals faster. Another one more point I would like to add. Quite a lot of patients, they will ask, when can we drive? I'm just trying to give this example, driving, because people can correlate with that when we talk about driving, because driving needs a little bit of movement and
that's right, absolutely.
all this thing. Normally, I will tell my patient that, you remember one patient we did, foreman in the garage guy. So people who drive, male, female, that when can we, I normally will say that you can drive after a month, And normally we will take out the stitches after 2 weeks. This patient of mine, I removed his stitches after 2 weeks. And then when he came for a follow-up after another 2 weeks, which is after a month of surgery, then I told him, because I knew that his question was very pertinent before doing the surgery. So I told him, I remembered that, and I told him that now you can drive and go home.
Yeah.
Then very politely and very this thing, he said, "Doctor, can I say you something if you don't mind? I drove after 2 weeks when you removed the stitches, so please don't get angry." So the point what I'm trying to say is that these are all, there is no fixed norm for this. I have had patients who was a horse rider. He, after 4 days itself, he was walking without any support, without a walker and everything. So the first, within few hours also, we can make you walk without that.
Yeah.
But the support system is just to let your healing process of the soft tissue. The bone part is already done. It's on the table, operation table. Within that 10 minutes, when the cement gets stuck, it's done.
Right.
So that is our prime time, goal time, that everything has to be done properly at that time.
Doctor, before closing, I would ask you this last question. This is very important for people. Out of all of this positivity, out of all of the information that you've given, out of every advancement that we have about total knee replacement, we've got robotics, still there will be a percentage of people who would be recommending to other patients, or who would think of themselves when they themselves need their surgery, नहीं, इससे क्या होगा? मेरी तो लाइफ ख़राब हो जाएगी. अगर गलती हो गई तो क्या होगा? मेरी तो टांग नहीं खड़ी हो सकता, मैं खड़ा नहीं हो सकूँगा या खड़ी हो सकूँगी. Or people also, put this. What do you have to say to these people?
Okay, straight away.
जिनको एक डर होता है कि पता नहीं क्या हो जाएगा.
देखिए, किस्मत किसी का भी खराब हो सकता है, ठीक है?
That's right.
So whereby I'm trying to say 2 points here. 99.9% of the surgery, knee replacement, is a successful surgery. That is why it has, I would say, people understand what is viral. So that is why knee replacement has become viral. People are doing right, left, and center. They are getting the knee replacement done. But 0.01%, that is, there are so many factors involved where it can go wrong. Okay, wrong means that your body cannot accept it.
Yeah.
So we can't, there is no mechanism that we can test whether your body can be. I know as a doctor, as an operating surgeon, the whole blame comes on us, whether an infection or because of patient's issue, if that goes wrong. The thing is that there is a revision knee replacement. Okay. So, God forbid, if you fall into that 0.01%, well, the failure or 1 or 2% is there. There is a lot of factor involved into that.
That's
infection can be there. Your body is not accepting the implant, or the doctor has done
could be a mistake or something.
Problem, or the sterility in the operation theater, or there could be you fall down and break your bones again.
That's right again.
So there is a revision knee replacement, which is a saving thing that revision can be done, which will again last for 15 to 20 years.
Okay, that's great.
Any knee replacement with the new technology, what we have, earlier we used to say that 10 to 15 years, but with the new implants and new technology, it can survive more than 20 years.
That's
but
great.
God forbid, if something goes wrong, don't be scared, because what I see, a lot of people, if they have seen 10 patients and 9 patients, they are doing very well, they are very happy, they are talking very nicely and their life has changed. But one person out of the 10 is saying that, no, I'm not very happy. Because that happiness is your internal perception, mindset. I can give you several examples. People, very close family friend whose both the knees are replaced, his expectation was that within 10 days I'll be flying off to UK and I'll be doing jumping and right. It doesn't happen like that. And I would say that it was my mistake that I did not counsel him, because I thought that he's like family and he will understand. And I was nearly about to lose the relationship with him. Allah saved me that after 4-5 months, then he understood, and so he was like sitting and looking at me as if why. So there is a lot of mindset. People have pain threshold. We too are talking about maybe a little pinch will cause you too much of pain, and maybe a little stabbing also will not cause me that much of pain.
That's right.
The same thing goes with the medicine also. Medicine you take, it may affect you within 5 minutes. It may cause me allergy.
That's right.
So there is a lot of disparity in that. So that mindset is there. So finally, I would say that don't be scared. Knee replacement is a permanent treatment, which definitely improves your quality of life. If God, Allah, Bhagwan has given you good mind and good heart, don't waste your quality of life just not to do knee replacement. That's what my message is.
Doctor, one-liner. Why the world needs Knee Health Day?
I want the world to understand and not to go into knee replacement. It's a permanent treatment. I'll be trolled for that, but I will not shy away from that. I want the society to understand that knee is something which is a very important part of your body, and it can be taken care of, provided we make them understand and promote this best message and knowledge about it.
Yeah, Doctor, thank you so very much for all the information that you've given. I believe a lot of information, a lot of people would understand about knee right from the beginning, I should say A to Z basically. And as you rightly said at the end, that why the world really needs a Knee Health Day.
Take care of your knee the way you take care of your heart. Heart gives you life,
and knee gives you quality of life. Take care.
Let's walk again with Dr. Knee.
Let's walk again. We will be back with another episode. Till then, take care.